Tim Stum. I'm the editor of Wisconsin Health News. We have a really great panel lined up today to talk about this very important topic. I am thrilled to introduce Lee Donahue, Education and Welfare Supervisor for the town of Campbell Health, Roy Irving, Hazard Assessment Section Chief in the Bureau of Environmental and Occupational Health at the Department of Health Services, Dr. Beth Neary, Co-President of the Wisconsin Environmental Health Network, Katie Rosenberg, Mayor of the City of Wausau, and Senator Eric Wimberger from Green Bay, and Sean Kirkby, Senior Editor of Wisconsin Health News, who will be moderating today's discussion. Before we get started, I want to make sure we thank our very generous sponsors of the Wisconsin Health News virtual series. These important discussions would not be possible without their support, so a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson Health System, Hush Blackwell, and Quartz. Wisconsin Health News is an online nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Quartz, today's featured sponsor. We are really grateful for all of their very generous and continued support of Wisconsin Health News. Here to say a few words on behalf of Quartz is Miranda Tank.
Thank you so much, Tim. It's an honor to introduce Quartz as a featured sponsor of this year's virtual event series. For those not already familiar with Quartz, we are a locally based provider-owned health insurance company dedicated to ensuring all of our members have access to a life well lived. For 40 years, we've provided our Wisconsin neighbors access to exceptional doctors, hospitals, and affordable healthcare programs. Alongside our provider partners at UW Health, Unity Point, Advocate Aurora, and Gunderson Health System, we now proudly serve members in communities across Illinois, Iowa, Minnesota, and Wisconsin. Our local roots and unique collaboration with our provider partners empower our members to live healthier because we're with them every step of their wellness journey. Our commitment is to serve our members and our community with quality care and to give back so our neighborhoods shine brighter. Quartz was proud to support the Wisconsin Health News virtual event series this year to help further discussions and raise awareness about important healthcare topics that impact the members and communities we serve. This year, the virtual event series has covered topics that affect Quartz's member population, provider partners, and clinical priorities. From increasing mental health care needs among Wisconsin residents, to new approaches to treating obesity, to challenges facing the healthcare workforce, and more, this year's event series has helped advance the conversations about crucial topics facing Wisconsin's healthcare industry. Quartz would like to extend our gratitude to Wisconsin Health News, all the other sponsors of this event series, and all of this year's featured speakers for helping further awareness of the issues impacting the communities we all serve.
Thank you, Miranda. And thanks again to Quartz for all of the important and very generous support. And with that, I'm going to hand it over to Sean to lead today's discussion.
Thanks, Tim. So the presence of forever chemicals in water is drawing attention from Wisconsinites throughout the state. Research has shown high levels of certain PFAS, which are a large group of long-lasting man-made chemicals used for decades in industry and consumer products, may cause health impacts, including increased risk of some cancers and pregnancy complications. A study released in November found 7 in 10 private wells in Wisconsin contained one or more PFAS, but few had a level above state health guidelines. Our panelists are going to take a deep dive into the impact of contamination in the state and what efforts are underway to address it. And I'd like to start with Dr. Neary. Dr. Neary, can you speak to what do we know about the impacts of PFAS on human health? What links are there between certain health conditions and these chemicals?
Okay, so as early as 1981, DuPont found evidence of birth defects in babies born to female employees who worked in the West Virginia plant, the Teflon plant, and they took the women off that line as a result. But in the late 1990s, public concern grew, and there was a case that was presented against DuPont, and they actually won the case, and it took place in Parkersville, West Virginia. And as part of the settlement in that case, they actually had to fund a study. And it's an excellent study. It's called the C8 study. And actually, it was the first large-scale longitudinal study of a population with high exposure. And the result of that study, they found 6 diseases in the population: hypercholesterolemia, high cholesterol, ulcerative colitis, thyroid disease, elevated blood pressure in pregnancy, and testicular and kidney cancer. And then one other thing is in 2022, the National Academy of Science, Education, and Medicine did an extensive review because they were trying to create guidelines for clinicians. How do we deal with patients with elevated PFAS? And what they found was the strongest evidence for 4 health outcomes. Again, dyslipidemia, elevated cholesterol, increased risk of kidney cancer in adults and children, and decreased antibody response in adults and children, and decreased infant and fetal growth.
Dr. Neary, what do we not know about the health impacts of PFAS? I mean, what are some areas of study that you feel are needed to be focused more on or are currently understudied to examine these links?
Well, if you look 20 years ago, there were probably a handful of studies on PFAS and health effects, and now it's in the thousands. So we're looking at other things such as breast cancer, thyroid disease, and in fact, last month, Mount Sinai published a study that using electronic medical records, they found a link not just between thyroid disease, but actually thyroid cancer. So we're going to look more carefully at specific cancers and other health effects.
And when it comes to the spread throughout the state, I mean, where is this a challenge and how widespread are PFAS?
It's extremely widespread. It's found in many consumer goods, anywhere from cosmetics to dental floss to ski wax. It's found in artificial turf. So if you're putting artificial turf in your community, then eventually that's going to sit in the landfill. It's in biosolids. So the bottom line is we need to not just clean it up, but we have to stop the flow into the environment. And I'm going to give a credit to our neighbors to the west. Minnesota in 2025 will eliminate it in what they call non-essential uses, cosmetics, ski wax, dental floss, things like that. So I'd like to see Wisconsin do that too.
Thanks, Dr. Neary. Roy, can you talk a little bit about DHS's role in responding to contamination? What parts of the state have you all been responding to, and what have been kind of your concerns about contamination in general?
Sure. Thanks, Sean. So DHS is closely partners with DNR, local health departments, and affected local communities to respond to situations where PFAS are found in the environment. Much of our work to date has focused on areas where either private wells are contaminated in the state or community drinking water systems are contaminated. In those situations, we've been involved in reviewing environmental data and helping issue drinking water health advisories that provide advice to people on continued use of their water. It also can enable the option of getting alternative water in certain circumstances through the DNR or well compensation for grant funding that has been available through DNR to a greater extent of late. We also partner with the DNR to review data on PFAS in fish, where we partner together to issue fish consumption advisories. And we've done that for about 24 areas in the state. And also we work together to develop health education materials focused on other ways that people may come into contact with PFAS, such as through using contaminated water when they're gardening at their homes, information on reducing PFAS in drinking water through the use of treatment devices, and as well, and as well some other actions that people can take, such as vacuuming their homes to reduce PFAS containing soil and dust in their living spaces. We also partner quite a bit with the UW. We've worked with them to develop tools that people can use so they can actually put in their private well results and assess the risk of the mixtures of PFAS posed that are present in their well water, rather than looking at each PFAS individually and comparing those to individual numbers. So kind of different levels of this, but overall, everything's geared at understanding risk, informing the public, and making recommendations of actions that can be taken to reduce or halt harmful exposures to PFAS.
And when it comes to that, are there certain parts of the state that DHS has responded to, or that you all are more kind of concerned about in terms of higher levels of these chemicals?
We've been involved in several of the big investigations around the state. So in the Marinette-Peshtigo area, over in French Island, in the Wausau area, when their community drinking water system was found to be affected, and up in Rhinelander in the town of Stella. Those are kind of the big ones, but there are areas elsewhere in the state where there may be one or two wells affected, or community water systems that have lower levels of PFAS, but still above levels of health concern, where we're partnering with others to make sure that the right information is getting to people so they know what they can do to protect themselves. And I would, Sean, sorry, one last thing. I would mention that the DNR has a very nice interactive data viewer for PFAS data that they have around the state, both for drinking water, surface water, fish, and PFAS cleanup sites. So for people who are interested in learning about what data are available for their area, that's an excellent resource to go check out.
Great. Are there any, Dr. Neer, he talked about some of the health effects of these chemicals. Are there any specific ones that, DHS is concerned about in terms of the impact of PFAS on people's health?
We're concerned about all of them. All of them are ones that merit attention and action.
Got it. And DHS has developed some recommended standards for PFAS contamination. Can you talk about the process of developing these standards, and kind of where are these recommended guidelines?
Sure. Yeah. So state law for developing groundwater standards requires a partnership between DHS and DNR. So our involvement at the state health department is to review scientific information on compounds. And in this case, we've done that for many PFAS, and review the scientific literature, review the information from the federal government, including any standards they might have developed. And then there's a very specific process we follow through based on state law to develop a recommended groundwater standard. We've developed recommended groundwater standards for 18 PFAS. And then sort of a step beyond that, we also recognize that while different PFAS compounds may cause different health effects, there are similarities across those 18. And even though their toxic potential differs, they should be assessed as a mixture, not as individual compounds. So we developed a hazard index approach, which looks at the risk posed by a mixture of PFAS found in water, not just comparing to individual numbers.
Great. Thanks, Roy. Lee, you represent the town of Campbell in western Wisconsin, which includes French Island and the Mississippi River, where the La Crosse Airport is located. Officials believe that firefighting foam there led to PFAS contamination in the community. Can you just sort of talk about what's been the impact of this contamination on the folks that you represent?
Sure. Well, I can tell you that the residents in the town of Campbell pretty much have been reeling since we were first told that there was a possibility of contamination in October of 2020. So it's been more than 3 years that we've been on this roller coaster now. And Campbell is working diligently to leverage a safe alternative water solution. In our particular case, our residents are private well owners, so we're different from municipalities that have municipal water. But what we have found is that we can access an alternative aquifer, which is between 130 and 500 feet deep. There are still compounds in that water that we would need to pre-treat and filter out. But right now, that is our best opportunity to build a municipal water system that would serve every resident in our community.
So Lee, can you talk a little bit about some of the precautions that residents have had to take? I know that the DNR has been delivering bottled water to the community for about 2 years now. What is this kind of like living with on a day-to-day basis?
Sure. Well, the first thing, you never turn on your tap unless you're just using it to rinse off a dish. Everything that you drink comes out of Culligan bottled water for our community. And that's what you use to water your pets. It's what you use to fill your coffee pot. It's what you use to cook your macaroni and cheese, right? Everything comes out of that bottled water. The only reason that we use water out of our tap is to flush our toilets or to take a shower, or like I said, rinse off a dish now and again. So it's difficult to say the least. I mean, these are 5-gallon bottles of water. They're very unwieldy. They have to be stored in a climate controlled area because otherwise they will freeze and crack and leak and so forth. And it's a real hardship for anybody who's not used to lifting up a very heavy bottle of water to use for their drinking and their consumption. But the bottom line really for us is that, you know, our lives as Midwesterners, we're farmers, right? We're hunters, we're fishermen, we're beer drinkers, right? And wine drinkers. And this is a big part of Midwest culture. When you can't grow food that you want to eat in your own backyard because your soil is contaminated and because your water that comes out of your hose is contaminated, it means that to have a backyard edible garden, right, you've got to import soil and you've got to import water. And, you know, that is a huge loss of quality of life. And when you have to worry about the ducks and the deer and the other wildlife that are often consumed, you have to worry about what they're using as a water source as well, right? Are they drinking out of contaminated streams and creeks? Because it's the circle of life, you know, it's just like the Lion King says, you know, it goes all the way through and it bioaccumulates everywhere. So it's accumulating in the soil. We've seen where I live that the plumes have grown and that the toxicity is increasing even in the last 3 years. So we have to address PFAS contamination in our state now. And I think we do that in a variety of ways. I think one is that we ban PFAS in manufacturing and industrial uses unless it absolutely is necessary as a piece of technical equipment that's in a laboratory that perhaps Roy would be using. I think that we definitely we prohibit the import of PFAS waste. Right now, there's PFAS waste from Europe that is headed our direction. It's insane that we have more than 102 communities in the state of Wisconsin that are struggling with PFAS contamination, and we would bring PFAS waste in from another state. And I think the last one is that we really have to challenge industry to develop the technology to break that carbon fluorine bond, because filtration is a temporary solution. If we can break that CF bond, then we don't have a toxic waste stream. That's huge. So there's definitely many layers that Wisconsinites need to address PFAS in our communities and in the environment.
Thanks, Lee. Mayor Rosenberg, last year, WASA's water determined that all 6 of the city's drinking water wells tested above recommended standards. What has this meant for city residents?
Yeah, well, it's not something that the city of Wausau had been talking a lot about, PFAS. And so now everybody talks about it. We all know about PFAS. We all have opinions, I suppose, too. But we've been working to first bring up PFAS literacy around here so we know why it's bad, why we need to put the filtration option on our drinking water treatment facility, and also how to protect yourself from these things. Dr. Neary mentioned that DuPont C8 case, and that's one of those things where after we got through the first year of our PFAS situation, there's actually a kind of a documentary from Mark Ruffalo, Dark Waters. And I watched that and I gotta say, like, it's terrifying. And when you look at the progression, he was playing an attorney. When you look at the progression of how he's looking at PFAS throughout that case, and you see him, my husband didn't notice this, but when you see him digging around in his cabinets at 3 in the morning, I was like, you know what he's doing, right? He's trying to get rid of all the Teflon pans. And I'm like, I already did that. You know, this is the kind of thing that we're talking about, is that it affects you every day. So we brought up the literacy advocacy statewide. I know Senator Wimberger has seen my face over and over again. I've gone to budget hearings. I've gone to PFAS legislation meetings to advocate and tell the story of Wausau, to make sure that people know that this is A, something that we're going through, but B, something that can be fixed through some of these technologies. So right now where we're at is we have a temporary filtration system going on. We're using a special resin and it's attracting all those PFAS. And then next year, hopefully before winter, our granular activated carbon system will be completely finished. And that will filter every drop of water that goes through our municipal drinking water treatment facility so that people can trust everything that's coming out of their well, out of their tap. But I will say right now, you can trust what's coming out of your tap in Wausau. That resin's working very well. The biggest problem we face is that it's very expensive to maintain. It costs about $1 million, a little more than that, to refresh that resin. And we need to do that. It's every a little bit less than a year. So we really want to get our permanent solution in so that we can stop paying that $1 million refresh fee.
Can you talk a little bit about where this contamination came from in the city wells? You mentioned that folks weren't as aware of this until, it was kind of discovered. I mean, what kind of led to that discovery?
Sure. Well, actually, one of our neighbors, our municipality, Rib Mountain, had a well that they had tested and it was very high. And now I'm looking at Lee's response to how much PFAS they're having. So she might laugh at this, but the high well that was discovered was somewhere around 130 parts per trillion. And so the DNR came to us and said, hey, would you like to test your wells so we can see what this looks like in your area? And of course, me, not necessarily knowing what would happen after we got the results, I said, absolutely, it's better to know. So we tested our wells and everyone came back positive for PFAS between around 20 parts per trillion and some of the higher ones were 50 parts per trillion. So we don't necessarily have our finger on exactly where the contamination was. There have been some news stories recently talking about some discoveries north of town when it comes to PFAS contamination in corporate wells. So we'll see, but that's something that we continue to investigate. And obviously, another part of this is cost recovery for our municipality. It's really expensive. It's extremely expensive. And we want to make sure that it's not just the Wausau ratepayers that are paying this. So we are involved in the multi-district litigation right now. And actually tonight we have a special meeting where we need to talk about if we want to stay in that multi-district litigation with some new information that we learned. So stay tuned for that, but we have to decide by next week, Monday, whether or not we're in that case still.
Thanks, Mayor. Senator Wimberger, the Green Bay area has also faced some high levels of PFAS contamination. Can you talk a little bit? I mean, what has been some of the sources of contamination? What have been the concerns of, your constituents?
Well, my district goes north all the way up to Marinette, so I've got that whole pollution plume in the Peshtigo area and around that kind of an epicenter. I would say it's kind of a current epicenter only because that's where the focus has been, but I would anticipate places like Stella and French Island and anywhere there's an airport or anything going on, I think is going to get a bigger picture where my area is not necessarily an epicenter, so to speak. But you've got obviously airports, the factory manufacturers testing and doing things directly in the ground. But I think and landfills, of course, if they're not properly controlled, contained. But I think that the hardest one to grapple with is going to be the biosolids because there's not even to this day not currently any sort of a DNR control over it. It's more like a guideline that if you're aware of a certain amount in the biosolids, it's recommended not to be spread if it's above 150,000 parts per trillion, 1.5 dry tons per acre. But it's not really enforceable, and no one has to really test for the PFAS in the biosolids yet. It's just that if you become aware of it, here are the guidelines, and that still happens to this day, and that's concerning to get a hold of. The other types or locations where these can happen is at least a relatively contained area, within several square miles, I suppose, and then you can come up with plans for things. But the biosolids is going to be lower levels, but widely spread. And I think that's going to be kind of a hard challenge.
And when it comes to that, I mean, how have your constituents kind of responded? I mean, what have been kind of their concerns about this plume?
Well, they don't want cancer. I mean, obviously that's step one. They want to drink clean water, and so those are the real obvious ones. The the challenging part, and they want the people who are responsible to be responsible. That is a bit of a legal challenge. I happen to be the reason I'm kind of involved in this more is because I am the attorney in the Senate caucus on the Republican side, at least. So I'm kind of, when the more complicated legal question comes around, that it's not just only my district, but I'm kind of able to figure some stuff out on a deeper level. But you can't do an ex post facto law to hold people accountable, so to speak, and you can't pass a law that declares someone guilty because that's called a bill of attainder. And so you've got to work in that paradigm of was there a law broken at the time, and is Josh Call and Governor Evers executing the law appropriately? And it seems like they're at least attempting that in the courts. But going forward, there does need to be a legal structure, and Senate Bill 312 kind of creates that structure to hopefully troubleshoot a lot of things.
So, Senator, can you speak a little bit more to that legislation? What are kind of some of the major parts of it? I understand it uses $125 million set aside in the state's 2023-25 budget to address PFAS. What are kind of the provisions that will have an impact on communities throughout the state?
Sure. It doesn't necessarily use the 125 million. It uses whatever is available for these things. So it's kind of like a grant framework, and then the DNR is going to say, well, we could use X amount of millions for this and X amount of millions for that, and kind of they come back to the finance committee, which I'm on, and then we'd approve a plan, so to speak. But this creates a framework of what kind of the main thrust of what we're trying to do. So first and foremost, help people get clean water with their wells, cased wells, deeper wells, whatever needs to happen. The help to the municipalities is important, and then kind of studies and whatever other testing and things that are kind of necessary in the ecosystem here of ideas, as the DNR is going to see fit. But the bill also troubleshoots some other things, which are the legal conundrums that people are going to be found in. Because if you're, for instance, on French Island, or in Stella or Peshigo or wherever, actually, if you're next to a farm that took biosolids, you're going to have this PFAS migrating through the water table. And once the way Section 292, the spills law, kind of operates is that if there's a migration of a pollution plume going through your property, then once the first molecule exits your property to another property, just because of the natural flow of the aquifer of the water table, you are going to be declared an emitter and subject to remediation orders. And so without the other kind of legal protections, if you don't do what the DNR says, it's a $5,000 per day fine, potentially. So it's hundreds of thousands of dollars in testing for wells, fines, whatever you don't comply. And so there's a good legal question to be had about this, because once you test your water and find out what you have, you're going to be obligated under the spills law to report it to the DNR. And then the DNR is going to turn around and say, well, thanks for telling us you're an emitter, and you're going to be subject to remediation orders now. So people don't want to test. Nobody's figuring anything out. So there's got to be a incentive built into the law here to not hold the people responsible who shouldn't be held responsible, because they're quote unquote labeled emitters technically, but they're really innocent landowners. And then we get a better kind of hold on what's going on. So the idea is it creates a framework for what an innocent landowner is, and then those people will be incentivized to be free to test and to figure out what's going on. So when they're declared an emitter, the bank doesn't call in their loan and they go bankrupt, and ultimately we get them a nice clean glass of water through a grant program that they'll never actually drink because they'll have to move and be financially destroyed. So we gotta kind of work both kind of angles at the same time.
When it comes to this legislation, there have been some concerns raised about the bill, and I think you were kind of touching on them a little bit. There are some fears that around the innocent landowner provision that it could allow those responsible for PFAS pollution off the hook. Those concerns have been raised by some environmental groups. There was also an amendment by Democratic lawmakers to the bill when it was in the Senate that would provide additional support to private well owners. Can you just sort of respond to these kind of concerns? I mean, do you think they're warranted? Kind of what is your response overall to them?
No, it's well, in my opinion, demagoguery. You have a concept, a characterization of what a polluter is, and a bunch of semantic overload into that concept of what a polluter is. According to Section 292 and also the cases State versus Mouthy and State versus Chrysler Outboard, someone who's going to be kind of categorized as a polluter is actually what they call an emitter, and that would be anybody who has a molecule coming off of their property into another adjoining property. So as the pollution plume goes from industry in Peshtigo, for instance, and goes all the way to the bay, every single one of those people are not only, I guess, victims of this, civilly at least, but then also victimizing their neighbor and eligible for all the legal ramifications related to that. So the idea of what is defined as an innocent landowner is right in the substitute amendment, they call it, which specifically excludes the manufacturers and industrial point sources. So it's specifically designed for that, and there's a legislative council memo coming out to make sure that people are clear on that. But when they say hold polluters accountable, it depends on what you're trying to say there, because a polluter is defined as not only the people in your mind's eye you would call a polluter, but also your neighbor who just happens to have a pollution plume going through it, and that's who we're trying to protect.
Got it. Where do things kind of stand with the bill right now? I believe it made it through the Senate last month, so it's pending the Assembly. Are you anticipating any additional changes to the measure?
No, I think it's the way it was. The kind of the arc of this was we put out a bill in June, hoping to get it done before the summer break, but that was kind of a pie in the sky. It was too much to go on, and there were some changes that needed to be made, plenty of them. So we took some recommendations from the DNR, from interest groups that were environmental activist groups that were good, and incorporated all those. We were in a bit of a delay in the fall because we wanted to have one final meeting with the governor himself instead of his staff that we've been working with. So we effected that one-on-one with the governor shortly before it passed in the Senate. And so as a result, we're going to have to delay the Assembly voting until January, it looks like. But I don't anticipate the Assembly trying to do anything with it other than in its form that it's in right now. And I'd be very concerned if there was any motion to try and do that, because there's a balancing here of what environmental groups want and what the DNR wants, what municipalities want, and then obviously what's palatable to legislators.
Got it. You mentioned.
Sean, can I jump in there for a second?
Sure.
Yeah, just a couple of things I want to touch on. And one of those is, I'll use Campbell as an example. We know that PFAS contamination came from the neighboring airport. We know that it was used in the firefighting foam, the AFFF. And so, what I see as a trend in the state of Wisconsin is that municipalities are going to the manufacturers who produce the products, knew that the products were toxic, and yet allowed the products to be used without any regulation. So You know, in my community, initially a very small neighborhood was identified as having toxic PFAS contamination. And yet, as we explored further, and I say we, I mean residents that paid out of their pocket $500 a pop to get their water tested, they weren't worried that they were going to become an emitter. They were worried about the health and safety of their family. And with those additional tests, we were able to present those to the DNR and show the DNR that the plumes were actually much larger than had originally been thought. And that has been very valuable. To my knowledge, the DNR, who I meet with and speak with on a weekly basis, has never come back to say, Lee Donahue, you live in Campbell and you have PFAS on your property. And guess what? There's PFAS on your neighbor's property, and that makes you an emitter. So I think that there's a, obviously there's a legal part of this, and then there's the part that we live day to day, which is we are trying to stop the PFAS contamination at the source, because otherwise we can just be chasing our tail on and on and on. And we really are relying on our state legislature and on the federal folks to be able to assist us to get to where we need to be. Thank you.
You know, Senator Wimberger, do you have a response to that at all?
Right. So that it's true that the DNR will say all day long, and even with in the governor's meeting, repeated this to me, that it's very rare that they will actually order someone into remediation. So my question back to them was, well, if it's very rare, if ever, that you're going to use this authority, why wouldn't you just relent and not want to keep this authority if you're never going to use it? And the response to me was, well, just in case. And I don't like that answer because it's an axe dangling over your neck. So it's not so much that the DNR is going to order you into remediation. It's that you own a property that's subject to remediation orders by law. So when you are going to go and try and sell your property, you will have to put into the disclosures that you have a property that emits a known hazardous substance, and no one's going to buy it. It's going to evaporate your entire property value. And then the bank is going to, once you make those disclosures, is going to become aware of it, and they're going to call in your balloon payment. You know that you have to refinance every 3. You know, it's amortized over 30 years, but most loans will have a reanalysis of the loan every 3 or 5 years. So they just won't want to refinance, and it'll be a complete disaster for a lot of people. So it's not so much that the DNR is going to do that, it's that they have the authority to, and then there's a lot of ramifications as a result.
Senator Wimberger, just one other sort of question. You mentioned this meeting with Governor Evers. I know that he had raised some concerns earlier in October about the proposal. Does he still have those concerns? Did he give any indication to you that he would support the bill or sign into law?
Well, I have to say, at first it was pretty much that, you know, you have to have a starting point. So he started the same point that he was making it publicly. But I think as we talked, at least he's starting to grasp the other viewpoint, that this is not trying to let any sort of manufacturer or industrial polluter off the hook. It's actually trying to create the right categorization of who's a polluter and who's an emitter, or who should be responsible as the point source, and who's unfortunately being caught up as the definition of an emitter. And so we'll see. I mean, you get thrown these ideas back and forth, you know, in person, and you've got to take some time to think about it, and you're not going to come out with a position necessarily right then and there. But I think that my concerns were adequately conveyed, and he took those into consideration, and we'll see where it goes. There's going to be at least another month and a half before he would sign it anyway, so there's probably going to be back and forth in between.
Thanks, Senator. Mayor Rosenberg, can you weigh in on this legislation a little bit? You had mentioned earlier you've been talking with Senator Wimberger about it. I mean, where do you kind of stand on it?
Yeah, so the city of Wausau did take a look at this, both our staff internally and also our city council weighed in officially too. And we offered our qualified support because we do want access to this funding. It's critical because the people of Wausau and the people of Wisconsin don't care who did the pollution. They just want to be able to drink their water. So that's the goal, but we did have some concerns about the effects on the spills law and a variety of other positions in this bill. So, we're optimistic about being able to do what's right for everybody here in our state with this bill and obviously give access to funding for remediation for communities and individuals. And I guess we kind of wait to see what's happening next. We've been in close contact with our legislators as well as the governor. So that's kind of where we're at. It was qualified support.
So Mayor, I was wondering, could you also speak to what some of the efforts the city of Wausau has been doing around this? You mentioned earlier there's potential for like a more permanent solution to remove these contaminants from the water. And I believe that got some attention from the White House or the Biden administration recently.
Yeah, so if there's one thing I have, it's a platform, being the mayor of my city. So I've been trying to get the attention of our federal partners. And thankfully, Senator Baldwin was listening to us and she came in and helped us get a congressionally directed spending allocation of $1.6 million, which is great. But our granular activated carbon system does cost $17.5 million. So it's still a pretty heavy lift for our community, just understanding how much that is. And, I've been hearing a lot about our water rates. They've gone up, 60% since we built a new drinking water treatment facility, since we have massively upgraded our wastewater treatment facility, and then this additional 17.5 million for granular activated carbon. So we did get some attention from the White House. It was also related to the lead pipes replacement that we're doing. We're actually doing a community-based public-private partnership to make sure that we can replace the 8,000 remaining lead service lines in our city. So Director Tom Perez came and visited us in November, checked it all out. He saw the big sign in front of our GAC system that said this project is paid for by by Joe Biden and the recovery funding. So he was excited about that. And we're excited too. But again, it is a heavy lift. We did get some support. We're excited to keep capitalizing on those funding through bipartisan infrastructure law, inflation reduction. But it's slow going to get that money and make sure that the people of Wausau still have the safe water.
Thanks, Mayor. Lee, I saw you had you raised your hand. Can you talk a little bit about some of the challenges financially with addressing PFAS contamination in the town of Campbell and elsewhere?
Yeah, absolutely. And I think Katie makes a really good point, right? The taxpayers right now are the folks that are bearing the cost, right? They are bearing it in a variety of ways. In communities like Katie's, where they are on municipal water, they're seeing their tax rates increase. In many communities, they're seeing the toxic health effects, and those are very real. And the medical bills that go with those, and unfortunately, the deaths that go along with those are very real. So, there are a number of effects that sometimes are a bit difficult to quantify those health effects, but these costs are being borne by the taxpayers. They're not being borne by the people who caused the pollution. And I think that we need to very carefully look at that. Who were the people that caused the pollution? And to look at these manufacturers and say, right, if you have a toxic substance and your toxic substance left your manufacturing plant and it ended up in the waterway, whether that's the Mississippi River, which is a huge part of the U.S. Fish and Wildlife National Refuge that spans 4 states, whether it's Green Bay and our Great Lakes, whether it's Starkweather Creek, that taxpayers cannot continue to bear this unbearable burden And that's one of the reasons that we need to make these changes to our laws and to work with our federal and state legislatures to try to clean this up so all of the burden is not falling on Joe and Jill taxpayer.
And when it comes to that, Lee, I understand that the town of Campbell, similar to Wausau, is looking at lawsuits or involved in lawsuits against over this kind of contamination. Can you elaborate a little bit more? I mean, would that also help address some of these financial concerns?
Well, ultimately, the manufacturers, in my mind, are responsible. They created a toxic substance. They knew there are memos that U.S. Army Corps of Engineers date back to the 1980s and 90s that said that these products were so toxic that they weren't even willing to conduct any testing with the products because they knew once the product got into a waterway that there would be no way to get that back out of Green Bay, the Mississippi River, our Great Lakes. So the knowledge has been out there for quite some time, and we need to follow up with the manufacturers who knew that these substances were toxic so that the burden, again, is not falling on individual residents and on states like Wisconsin, which currently has more than 100 communities with toxic water out of 72 counties.
Thanks. Dr. Neary, could you talk a little bit about the what do you think of current efforts in the state to address PFAS, and kind of are they enough, and what else is needed?
Absolutely not. They're not enough. If our neighbors in Minnesota can do legislation to stop the flow into the environment, why can't we do that? I thought Wisconsin was the environmental leader in this country. So absolutely not. I mean, when I think about how long it takes for legislation to happen, I'm thinking about babies being born, fetuses being affected. Any toxicant affects the developing fetus and children the most. We can't wait. No, we need to do more.
And can you elaborate a little bit more on what you would like to see done? What other actions should be taken by state legislators or the federal government or others to address these issues?
Okay, so other states have taken the initiative to ban it in what I call non-essential uses. So Maine, California, New York, Minnesota is going to do it soon. It doesn't need to be in cosmetics and ski wax and all of these other products. And so why can't we? The federal government takes a while to do this stuff. So that's why states are taking the initiative on this. We should also have state funding for our rural citizens so that they have money to clean up their wells. We need to inform physicians across this state about how to deal with their patients that have elevated levels too. So on so many levels, we need to act.
Thanks, Dr. Neary. Senator Wimberger, I saw that you wanted to respond to some things. Could you talk a little bit about what other sort of legislation too is needed beyond what you've proposed so far to address contamination in the state?
As far as the kind of general idea of eliminating PFAS in products, I haven't heard much opposition to that. It's more like making sure the appropriate glide path, kind of like Minnesota is doing a 2-year rundown or what have you, because there are various industries. For instance, in my area, the paper industry, there's a PFAS used on some of the rewinders on toilet paper and other paper products. So you'd have to kind of retool your machines, and if you instantaneously shut it down, it would cause some major problems in a different way. But some sort of transition in short order, I think, would get some support in the legislature at this point. The other thing is, when we're talking about the biosolids in particular, or the how it gets spread around in the rural areas, there's a problem there in the fact of what's called an intervening act, and that's kind of the main fight between industry and in the court there and the states. Is that, was it but for the industry that it ended up on the farm field, or was it but for the municipality or whoever who consciously chose to take what was previously a hazardous substance, all that stuff coming out of the end of the pipe? and then declaring it safe and putting it on farm fields. Who's actually responsible at that point? And the example that can be used is, if I give you a bottle of bleach, you know that this bottle of bleach could be an unknown hazardous thing, I suppose. Whatever's coming down the pipe in a sewer is an unknown hazardous substance. That's why it goes to the treatment plant, because you have to figure out what's in it. If I give you that bottle of bleach and then you put it at the bottom shelf of underneath your sink, and then your kid drinks it, was it my fault that your kid drank the bleach, or was it your intervening act of putting it somewhere that was the proximate cause? And those are the challenges that are going to be had with who's responsible for what. Obviously, my bill and what's in current law with 292 affords for no change in the liabilities that would otherwise exist. And I would anticipate actually that what's going to happen is industry will be liable in a very similar way that they were liable for PCBs in our area. I don't know if you know the PCB issue, but the Fox River in the Green Bay area had PCBs. And so who's going to pay for what and how much? And that was actually litigated for probably 5 to 10 years. And then they split out billions and billions of which paper companies were going to pay what. And that's how that kind of shook out. So I would anticipate the problem kind of ironing out that way. But when it comes to going on the farm fields, there's a big question there of an intervening act. And then going to the municipality and trying to seek remedy from them is going to be hard, or the DNR, because in Section 292 is a sovereign immunity clause that prohibits going at them legally. So at the end of the day, you either maybe find a lawsuit that gets litigated for 10 or 15 years. You try to get the municipality, the state could sue the municipality, maybe, I don't know. But then the municipality is going to claim sovereign immunity plus contribution from the DNR. So at the end of the day, this is kind of a state issue all the way around, not only on a legal sense, but also on the proximate necessity to get people clean water, I think.
So Senator Wimberger, just to follow up for one of the things you had mentioned in the offset, you had mentioned that there was not much opposition in the legislature, or that there might be some interest in some legislation that would restrict the use of PFAS in certain contaminants, not contaminants, but certain products similar to Minnesota. That is a question of glide path. I mean, are you looking to sponsor legislation like that? Are you open to pursuing that in the legislature?
Sure. Yeah, I am very open to that. One of the overarching pictures here is that despite whether you want to do legislation or have the rulemaking process, which is kind of the whole point of having rulemaking processes through the DNR is to be more nimble, because you're going to have 10,000 plus versions of this, and then you can promulgate rules as the newest science comes out. We're also going to be bound to adopt federal guidelines by Section 160 in the state statute. So whatever new federal rules come out, we adopt those through the administrative rulemaking process. Doing laws can be challenging to get them through in time, because you're only really on the floor voting on stuff periodically. And then on top of that, you end up with situations of repealing. So for instance, if we had done a 70 part per trillion 3 years ago, that was asked for from a lot of interest groups, do codify 70 parts per trillion or what have you that the EPA is recommending, they'd be asking for a repeal of that 70 part per trillion back down to whatever the latest thing is. And to keep on rehashing those numbers is precisely why we have an administrative process and an administrative code to properly address that kind of a nebulous and flux situation in flux. But generally speaking, to come up with some rubric to glide path off PFAS, I think actually would have some support in the legislature.
Thanks, Senator. Mayor Rosenberg, could you talk a little bit about what actions you see needed in the legislature and maybe respond to some of the things that have been said?
Yeah, sure. So first of all, Wausau is located in Marathon County, a very rural county. We have a lot of farmers surrounding us, a lot of whom maybe rely on biosolids and things like that for their farm fields. And what we're seeing now is that, as we test our wastewater, the effects of our remediation on drinking water is having an effect on the biosolids. So positively, it's good. Those numbers are going down. So we're happy about that. And obviously we know what's coming ahead with the EPA's numbers, putting us at 4 parts per trillion. So that's the goal whenever we need to be there. I think maybe when it comes to SB 312, the bill that we're kind of talking through, one of the questions that environmental groups and, even folks here on our city council have asked is related to that process by which somebody can qualify as an innocent landowner. Folks are wondering if anybody can qualify for that, if that through that process, right? What happens when the responsible party tries to qualify for that? And I think that's what people are nervous about here, especially, and what qualifies that support. We obviously want to be able to work together as state, local, and federal governments to do what's right for the people. And sometimes those questions are causing consternation in our communities.
Thank you, Mayor. Lee, could you talk a little bit about this? I mean, what sort of actions do you see needed at the state, federal, other levels?
Well, I think the one key is the fact that, if we go back to PCBs and lead and other toxic substances, right? It was the DNR and the DHS that really gave us the tools that we needed to address those types of contamination. And so I think that it's really important that we uphold support for the DNR and the DHS to be able to do their jobs as information changes, as new studies are conducted, as the EPA creates new standards, that we are able to respond as quickly as possible to protect the citizens of Wisconsin.
Thanks, Lee. Roy, kind of wanted to wrap up with you. Could you talk a little bit about what sort of research that you see is still needed around PFAS that would be very, pertinent in helping people maybe in clinical areas, and what kind of further efforts to bring awareness to this issue are needed?
Sure. So there are some ongoing studies that the federal government is currently conducting. It's a federal agency called the Agency for Toxic Substances and Disease Registry, or ATSDR. They're conducting multi-site human health studies looking at 8 different sites across the nation to look at associations between various human health effects and PFAS. So those are underway, and we're incredibly interested to see what the results of those will be. And kind of building on what Lee said, the science really needs to continue to grow in several different ways. One is that we know the most about PFOS and PFOA, which are 2 compounds that were widely used, but they're not really, they've been phased out voluntarily in a lot of ways. So they're in the environment, but there are a lot of newer PFAS that are being introduced to the market, which we know quite a bit less about. So more science understanding the human health implications of new PFAS that are coming on the market, that are getting into the environment, is really important. Biosolids were mentioned several times today. Understanding the uptake of PFAS into foods grown in areas that have contamination is incredibly important. It's something we receive lots of questions about, and it's something that still is an evolving area of the science. And I think also continuing to understand where PFAS occur in the state is important. There are efforts that the DNR has done to help shed light on that, and more is required. And you asked about clinical. I think there's other exposure pathways, such as through breastfeeding, that needs more research to provide more guidance to clinicians on what to do for people who live in contaminated areas. Overall, a better scientific understanding will only enhance our ability to protect public health. So that's very, very important.
Thanks, Roy. And we're out of time now, but I want to thank all the panelists for participating. I think it was a really good discussion. Really appreciate all the time. We're holding an event next week in Madison in person. That is our hospital CEO roundtable. So tune into that if you're interested. And thanks once again for everyone for participating. Very busy time of year, so really appreciate it.